The main goal of the discussion of findings or the clinical part of the case presentation is to get agreement on the clinical findings and treatment alternatives, not on the cost or the insurance or co-payments. There will be another video on getting agreement on the cost and the financial agreement. But there is no point in discussing financial arrangements if the patient does not agree with the findings. However, I see this all the time. The case presentation completely bypasses the agreement on clinical findings and focuses on insurance benefits and co-payments without getting the patient's reality on his current condition. Understanding clinical findings for someone who is not familiar with the mouth and how it works is not easy. For all of us who work in dentistry, there are certain conditions that seem pretty obvious because we have studied them and we see them on a regular basis. However, for patients, it is not something that they're used to seeing. So we're going to have to exercise some patience and do our best to see things from the patient's point of view. To find out what is the patient's perception, before we even look into the patient's mouth, before grabbing the intraoral mirror and look at the x-rays, we're going to determine what is the patient's level of awareness about his mouth state of affairs. We start with the usual questions about the chief complaint, like, are you aware of anything that might need attention? Do you have any specific concerns? What has been an issue for you in the last few weeks or months? In general, have you had a good or a bad experience? A couple of questions like these will help you determine the patient's awareness and their attitude towards dental treatment. Are they proactive, skeptical, or chronic procrastinators? All these factors will help you navigate the case presentation. For some patients, you're going to have to use plain general terms to describe your findings, while for others, you will need to be a little more descriptive. So let me give you a couple of tips that in my experience can help you make the case presentation more patient-friendly. The first one is don't confuse them. It is important to read your presentation of any dental terms that can have a negative reaction, like root canal, SRPs, surgical, implant. These words prime the patient's mind and they start overthinking about the tools and the costs. Just let them know that you will be using code names and that you will be explaining everything at the end of the exam. Another tip is don't be boring. This is a huge mistake that most clinical providers make, which is entering into a monologue without getting any feedback from the patient. This is not easy to do, and in my experience, it requires practice in the form of role-playing exercises with other staff members to help you figure out when you need to stop talking and start listening. And yes, I know that you're there to educate your patients, but make it a dialogue instead of a monologue. Also, don't overwhelm them with information. Don't give them 6 treatment options. You need to do your best to narrow it down to 1 to 2 options. That's it. Otherwise, there will be a point during your presentation when the patient is going to look at you like a deer caught in the headlights. That should be your clue to stop speaking. This is one of those cases when less is more, because otherwise you will introduce uncertainty in the patient's mind and create analysis paralysis. And that's why a lot of patients have to think about it. Make sure you don't invalidate them. Talking bad about the existing dental work, besides being unethical, is a bad idea. You don't start a relationship by criticizing and pointing out the defects of the previous person. Those kinds of remarks sometimes speak about the patient's inability to make a sound decision. Besides, the work could have been done by someone close to the patient, so try your best to highlight the effort made by the previous provider to keep that patient's smile in shape. And last, use visual aids. Visual aids are a critical part of any presentation because most people are visual thinkers. That means that we use images to make sense of the world around us. The dental field is full of words that can be misinterpreted. Words like cap, crown, plate mean different things for different people. The only way to make sure they visualize what we mean is by showing them with pictures, models, or videos. Since the reality in our heads is based on a collection of images and stories, you can help create a new understanding of any concept if you use the proper visual aids. Now, keep in mind that acceptance of findings and treatment is not the same as case acceptance. But if you're able to raise the value and the need for the treatment in the patient's mind, you're halfway there, and it will make the financial discussion a lot easier later. And that's it for now. I hope this helps. And now we can move on to the financial agreement. See you there.